Hello everyone, my name is Dr. Tamisha Denis. We are going to discuss the number one reason that people are afraid to go to the dentist.
Wow!
Aha! This is Dr. Tamisha Denis and this is the Modern Smile. So let's jump right into it. Oftentimes I meet someone and the first thing that they say to me is how much they hate going to the dentist. They also like to talk about how much they hate certain things about going to the dentist. So the first thing that we're going to talk about is the needle. People are afraid of the dental needle. I have to say, it is a reasonable fear.
Come on, you scream like a girl. Do it like this.
To be afraid of somebody injecting you in your mouth. Obviously, none of that is pleasant. Even dental anesthetic is so important because dental anesthetic makes your procedure possible. Dental anesthetic is what makes it not painful. So if you don't get it, how are you going to get through something that you already feel is not pleasant? So we need to conquer that fear of the dental needle level. The funny thing is I meet people all the time who have tattoos all over their whole body and have done all kinds of other things, and they do not place dental anesthetic and having a shot in their mouth in the same category. They consider it totally different when it comes to having that done. So what I'm gonna do, because part of the goal of my channel is to demystify a lot of the things that we see as something that is scary, and really the only tool I have against that is information.
Hello to my little friend.
So here I have, from my office, a dental syringe and needle. So I'm gonna go through how this works. Now, if you're somebody who doesn't like this, I still encourage you to watch this so that you can know what your dentist is doing behind your back.
Where are you? Here.
And you can understand how it works. So this is a dental syringe, okay? This is a dental syringe. Now, the reason that dental anesthetic, one of the reasons that dental anesthetic gets such a bad reputation is because of this thing. Now, the reason this thing scares people is because they see this whole apparatus as a part of the needle. This is not the needle. This is what I use to hold on to the anesthetic, because inside of here is where the carpule of anesthetic is gonna go. And then here is just a plunger. Nothing is sharp on here. And I need this because I need something to put my hands on. So obviously people see this and they say, oh my gosh, you're gonna stick that in my mouth? No, this is only so I can hold on to it. So I'm gonna show you how it's assembled. So the first thing that we do is there's this little thing right here, and we're gonna stick this inside. So I pull this back because it has a little spring and we put it in here. Okay, so here I have a Septicane, which we can talk about in another one. So here is the liquid is inside of here. The next thing, now, depending on what kind of shot that you need, what kind of anesthetic, what's the area of your mouth that the dentist is going to be working on, there is going to be two kinds of needles typically a dentist will use. One will be a short needle and one will be a long needle. Now, the reason we use short is because we don't have a long distance to go. And the long one is because we have a long distance to go. Now, the reason I'm gonna open this and show you is to take away what you are afraid of, because most people are saying, oh my gosh, the needle's so long. The needle length has only because we need to get to that part of your mouth. Obviously, if you had a little tiny one, how could we get in the back of your mouth? So here is a short needle. Now, what we do with dentistry is usually, if we're on the top, we'll use a short one because it's easier to get to. So I'm gonna open this up, and that's the bottom part of it. And I'm gonna show you how we put it in. So we put it in just like this. It plunges into like a little hole at the top, and we wind it in. Now, of course, this looks really scary, but remember, all I do is I need to be able to hold on to this. Now I'm gonna show you the actual needle. Look at that needle. Yes, everybody's gonna say it's so scary, but I'm telling you, you see the tip of that needle is all you feel. The tip, the length of it doesn't matter. If I made this a mile long, you're not gonna feel the length of this needle. This is only so that we can get in there. Now the tip of it, you see I even poke my finger with it. The tip of it, even that is not the painful part. The painful part is because when we're injecting this inside, what happens is this liquid needs to travel into tight spaces. The tighter the space, the more painful. So what happens is when I stick this in, yes, you feel the initial pinch, And then when I'm pushing the liquid in, you feel the pressure of this liquid going to a space where there was no liquid before. That's the pain. Now, I was taught in dental school a different kind of way. We were always taught to go slow, right? So when we go slow, all we're doing is going slowly, so that as the anesthetic goes into, it's not pushing on everything really hard and causing you a lot of pain. Now, if you're a dentist with no finesse, what you're gonna do is just stick it in there and just plunge it. And of course, the person's gonna jump up and scream and shout because that's really painful. The tighter the spaces, the more pain it will cause. For example, the roof of your mouth, you basically have gum, and your bone is right there. So when you stick that anesthetic in there and you squeeze that, you're pulling those things apart, and that's really painful. So that's truly where the pain comes from. Now, in hard to reach places, like all the way in the back, we'll use a longer needle. But remember, don't be afraid of the whole needle. I'm just holding it, that's all. So then I'm gonna take this off. And then this thing goes in here. Now, all the people who are afraid of needles are gonna freak out. This is much longer, right? Compared to this one, right? So this looks much longer, and that's just because we use this typically to go all the way in the back of the mouth. Again, see, look. It's not even that bad. Now it has to pierce your skin because we got to get into that gum, but it really isn't. So that's what we use, and typically you'll see a dentist will use a longer needle in the back. All the way in the back, because that needs to reach all the way back here. And obviously, if I had a short needle, how far would I have to go into your mouth to get? Now, besides going nice and slow and putting the anesthetic in, another thing that I like to do is wiggle the cheek. Right? We wiggle the lip. Just to keep you a little bit more distracted so you don't feel the pain so much. Another thing that we like to do as dentists is we use topical anesthetic. So this stuff, this is in a mint flavor. They come up with all kinds. Pina colada, cherry, everything. We put this is a topical anesthetic. If you watch my video about me taking my daughter's baby tooth out, it's the same stuff. It's 20% benzocaine. We swab it on the area, we put a gauze, we let it sit for a while, and it takes most of that pinch of the needle away. Now, again, a lot of that stuff doesn't really have to do with you. It more has to do with the dentist and how they are going to help get you through that. For me, what I like to do is I like to tell my patients, breathe. Close your eyes, try to breathe through it. Literally, if you wait like 5 seconds or so, in 5 seconds, the pain will be gone. I don't have any tattoos. However, I said, if you get a tattoo, you have to sit there for a couple hours depending on the size of the tattoo, and that's painful. I know that they put some topical anesthetics and things like that. Maybe somebody can correct me if I'm wrong in the comments below, but I know a lot of people can tolerate that a lot better than dental anesthetic, but it will go away. So that is my number one thing that I get of people that are afraid of the dentist. Now, all of those strategies that I mentioned before are more of the things that the dentist does for you. Now, what can you do to make it not so scary, not so painful? So the dentist is wiggling your lip, they're telling you to close your eyes, they're telling you to take nice deep breaths. You have to do that too. Another really, really good strategy is for you to listen to music during your dental appointment. You can bring headphones, you can bring little earbuds, you can bring your AirPods, you can bring whatever you need to distract yourself from that. Put yourself in a nice, calming, relaxing state. Count to yourself. Tell yourself positive affirmations, and that will help that to go better. You want to be as relaxed as possible. I tell patients all the time, when you tighten your body up, so a lot of people, they like to what we call white knuckle it. They grab the dental chair and they squeeze as hard as possible, and their whole bodies are so tight, that actually makes it hurt more. When you breathe and you relax, it makes the dental anesthetic go so much better, and you're so much in a better place. So those are my tips for how to make dental anesthetic a much more pleasant experience going to the dentist. Yes, it's never going to be fun. However, it's really important for you can do anything you can to get that done, because so many people avoid the dentist so long, their problems get worse when sometimes it's something simple they can fix, and in an attempt to avoid it, they actually cause themselves so much more pain and discomfort. So I hope that helped. I hope I didn't scare you too much with all of my showing on the needles, but I'm pretty positive that if you approach this one portion of the dental experience, it's going to open up so many doors for you to be able to get your work done. This is Dr. Tamisha Denis of The Modern Smile. If you have any questions about anesthetic, if you want to share your story, make sure to comment down below and let me know, and I'd love to answer your questions. Every Tuesday, we do a dentist live where I answer questions live from your comments that you put on this video, and then I also interact with you guys and answer any questions that you may have. Alrighty, see you next time, and stay tuned for part 2, the second most scariest thing that people hate at the dentist.
So give me some fake hugs right now and laugh real loud like we're the happiest family on earth. Is that possible? Laughing. That's it. Laugh loud and laugh. I love you guys.